And welcome back. Well, low back pain is one of the most common health complaints, and it can slow you down and even stop you in your tracks if the pain is severe.
Joining us now with the natural solution to low back pain, sciatica, and disc issues is Dr. Jonathan Stevenson from Strive Integrative Health. Great to see you.
Yeah,
Thanks for having me. Great to be here.
What do you think it is about your approach to low back pain that's different maybe than other treatments people are used to hearing about from their doctor?
Yeah, that's a great question. Really, I think we stand out in two different ways. One, we really sit knee to knee with our patients. We get to know them, find out exactly what's going on and what it's impacting in their life to set up goals, to really make sure that we're striving towards something that they want and that they want to achieve. Of course, we'll do any orthopedic exams and then we'll take any necessary x-rays to really get to that root cause. And then number two is we do a very unique approach to go after that root cause and really help keep their pain away, to keep them out there doing the things they love to do and just keep living.
Yeah. Talk about some of the equipment, because you've shared some of it before, and some of the equipment pieces that you use. I'm always like, I wish you could bring it in just so we can use it. But they're big. They're big and heavy. You can't. So what do you all have that you use?
Yeah, I think this is one of the most important things when it comes to what we do. We call it our 4R revival system. So we restore, rehydrate, repair, and then reinforce the area. So the first thing that we need to do is restore proper nerve function. Our brain's really important, right? It controls every cell, organ, and tissue in our body, and then it goes down through the spinal system. We want to make sure that system is working properly. We do that through the chiropractic adjustment. We use something called the pulse star, so you don't get all the popping, snapping, and clicking, probably the stuff that you see on Instagram, TikTok, Facebook, all of that stuff. But it helps restore that nerve function in a very safe and effective way for our patients that are in severe pain, have degeneration, arthritis, where that manual adjustment just doesn't work well anymore for them.
Interesting.
We take it a step further by rehydrating those joints. That's the back on track that you can see right there on the segment. But it helps open up those joint spaces, take that pressure off of the nerve to get those patients
Looks like it feels
moving.
good.
Oh,
yes.
It's everybody's favorite when they come into the office. So luckily they weigh 300 pounds, so you can't walk out of the door with them. So,
that's why I was like, bring it in. He's like, I can't.
a lot of our patients would. We take it a step further. We need to repair that soft tissue around the area too. So we use something that uses acoustic waves to help break up scar tissue, adhesive tissue, and really lay down the groundwork for new healthy tissue to form by bringing blood flow and stem cell production into the area. After these three things, our patients are feeling fantastic. But we take it a step further. We need to reinforce that area to make sure the problem doesn't come back. And I think this is one of the most important things. If we don't do that, the problem comes back, right? We need to stabilize and strengthen the area that was once injured to really keep that patient feeling and functioning better for a long, long time for our patients.
You've been here before talking about your red light therapy. Is that something that you use for low back pain to complement any of the things that you just described?
Of course. So it doesn't have to be a part of our low back pain cases, our disc issues, or sciatica, but a lot of patients see it and they see the benefits of it. It helps speed up recovery time by up to 10 times faster. And then it also helps just re-energize people, really get them moving properly again, which is great when it's like negative 14 degrees outside today, right?
Exactly. We all need a little re-energizing right now.
Exactly.
Talk about some maybe of the patients or the cases, the kinds of things that you've seen in your office.
We see a little bit of everything that comes into our office. I mean, we've had a guy that came in a walker and now he's walking without a walker.
Wow.
We've had patients where they couldn't get onto the ground to play with their grandkids anymore. Now she can get on the ground, play with their grandkids, and have fun, do everything that life is about. So really giving people their quality of life back is what we're all about. So that's why, going back to the beginning, we love setting goals for our patients. So when they achieve that, they know what we're doing is actually working in their quality of life.
How long does it usually take for someone to start feeling better, especially with low back pain that we've been talking about?
A lot of our patients feel better that first week.
Wow.
Now I say that first month, we could ride a wave where we have really good days, we have bad days, but we're making progress towards the end result that we're looking for. Most of our patients, once we get to that 1 month mark, they're feeling really good. They're right around 60 to 70% improvement in most cases.
Wow.
Yeah. It sounds like that could take a while, but it's like when you're living with back pain, it's like 1 month is nothing. You're like, all right, if I'm better in a month, I'm happy.
Yes.
Yeah, exactly.
Exactly.
So you can help determine if someone's a good candidate if they come in to see you.
Yep, so that's why we always sit down with them, find out what's going on, past medical history. A lot of our patients have had previous surgeries, injections, and rely on pain medications. So we
Yeah.
have to find what hasn't worked to make sure that we find something that does work for them in a very safe and effective way to help them get back to living life.
Yeah.
I'm sure it's exciting for people to get off medication too if they've been on it, especially for a while.
Yep, that's one of the biggest goals that we see come into our office and help prevent surgeries. A lot of people have someone who has had a back surgery in their family or their network, and they still have low back pain. So they're looking for other options that are non-invasive, non-surgical, non-medicated, natural ways to taking care of low back pain.
Yeah.
Great.
Got to get on it.
Great
Good to see you, Jonathan.
Thank
great
you
to be
so
here.
much. And right now, Strive Integrative Health is looking for 15 motivated people to experience life-changing pain relief. For a limited time, their 2-day back pain relief jumpstart program is just $49. It includes the Back on Track spinal traction treatment, free vibration session, and free consultation. It's time that you put yourself first and start your body transformation. So call now. The number is 262-649-2438, or for more information, visit go-strive.com.